Good afternoon. Since it's 4 on the dot, and I have such a wonderful audience, I thought I would start on time. So it's not snowing today. Do you know that? Okay, very good. And we're a week later, but I'm really happy to come before you. And we're going to get somewhat serious throughout the talk, so maybe for a little levity to just thank you and to really tell you how much I've looked forward to celebrating a year and a few months from when I first started here. So I'm going to start. So good afternoon to students. Can I see if there are students in the audience? Oh, good. All right, very good. Students, staff, faculty here in the auditorium, but also joining us by web stream. And so I won't have face-to-face contact, but really important to let you know that it's important for me that as many of you participate in this process, and while there won't be a question and answer period for today, because it's my report to you, there will be plenty of opportunities for dialogue. So how quickly a year has passed. A year ago, I was installed as the 7th president of Upstate Medical University. For me, the past year has been intense, adjusting to Syracuse, getting to know you all, sharpening the focus on our mission, vision, and values, and developing a strong leadership team to meet the challenges to make this academic medical center a university, a high-performing learning organization. That's a process. Today, at my first presidential state of Upstate Medical University, I will start with the vision that together we have crafted over the past months. United in expertise, compassion, and hope to create a healthier world for all. These key words are the theme of my speech to you today. The theme of my inaugural address a year ago, if you can remember, was local and global connectivity, with our identification as one university. The critical question, however, is how do we function as one university? How, in the face of our history, both good and bad, are we able to move past disappointments, lack of trust and transparency, to build on strengths and function in unison? These are the questions we asked ourselves throughout the past year. First, articulating the vision, I believe, is important. Saying this intent out loud without undermining our own progress, and proceeding to identify key elements of success and hope is important. Necessary to that process is a respectful, structured, data-driven, and inclusive approach. 3 of my initial steps were as follows, and for some of you who have lived this with me, you know these, but it's worth repeating. The re-review of the University Pulse Survey, which I did, the engagement of an external review of the university, and the establishment of the Office of Strategic Affairs and Regional Strategy. Please note that a review of the results of the Pulse Survey administered as you prepared for the process of hiring the new president, me, helped inform my viewpoint as to the direction needed. The main views expressed by those responding to the survey that I took to heart were the following: the need for visibility of the president, the need for effective communication, the need for trust and transparency, and all its related characteristics: integrity, respect, humility, and inclusion. And you noted the lack of collaboration and integration across the institution. These are the things that you shared with me, and expressed a need to focus on solutions to these. What I heard from many of you was a concern regarding inertia, the lack of forward movement, the lack of confidence and willingness to make decisions in general, and certainly impasse in the face of uncertainty and disagreement. And news for us, we are in uncertain times. I also heard your deep love of Syracuse and the surrounding areas. Throughout my travels in Upstate, and here, my executive team knows, and I hope they're smiling with me, is that I got into a bad habit of taking photos while driving. Please don't repeat that. But what I was truly amazed by, and I am digressing a little, which I'm known to do, is how beautiful this region was, okay? And I don't know, I think it's a well-kept secret. And so I took photos throughout and actually started to show those photos as we met. So I say, I too have been impressed by the incredible beauty of this region and its people. In addition, there was the clear need for a strategic plan, certainly timely since the sunsetting of the strategic plan Engaging Excellence completed in 2010, more than 5 years ago, so this was timely. A caution from the prior experience that I heard, though, was the following, was the lack of linkage of strategy to resources. In addition was the caution that I think you've all heard. You know it, right? Culture eats strategy for lunch, okay? Indicating, unfortunately, a deep cynicism in our ability to unite and achieve our stated goals and objectives. A change in our culture would indeed be our greatest challenge. To note also was the palpable feeling during the process, a concept expressed by one of our deans, that of impermanence. Impermanence, he describes as one of the doctrines of Buddhism, expresses the notion that without exception, everything is transient and in a state of flux. He continued, quote, "We should ensure that change is for the better and drive the change towards a common vision that we can all be proud in completing." He concluded in referencing my inauguration as your president, quote, "It is time to roll up our sleeves and start the process of change for which we have all been waiting." So I thought I would repeat those words to you because they resonated for me. Explicit awareness that we are in a state of flux is important in acknowledging our own anxiety and enthusiasm as we go through the process, and that we measure the results of that change with transparency, and hence that we all own that change. A strategic planning process of inclusion and the use of data, and I hope you'll see that I will repeat the term data and information throughout the talk, as I believe is how we will achieve this. I invite your continued participation now and going forward, and we'll share the results of our process thus far and later in my talk. And I'll digress 2 seconds to tell you I was recently at a faculty council meeting where we talked about faculty engagement. I hope the faculty in the audience do not hesitate to be engaged, okay? Don't ask permission to be engaged. Don't think too much about it. Just jump in, all right? Because we can't afford to not have you engaged. So within the first month of my tenure, I commissioned an external review. It makes sense, right? You come into a new situation, you should get a sense of what's going on. That review has been posted on the web for those of you who have not seen it, and continues to be posted. But the key endeavors of that external review was to assess the degree to which we functioned as one university. The domains of this high-level review were as follows, and I'll go through them quickly. An environmental scan of the university to assess the organizational structure and alignment of the medical center, including the university hospital, colleges of medicine, nursing, graduate studies, and health professions, poised to achieve a broad vision for this one university concept. A review of governance and communication within the university, including that by the basic science and clinical departments, and related issues of practice plan, funds flow, compensation, performance metrics, and the relationship between the colleges and the hospital. I hope those themes are familiar to you. An assessment of how we identify and focus on our strengths, acknowledge our weaknesses, assess and take advantage of opportunities, and respond to threats to our very survival. As the only academic medical center and health science university in central New York, and I'll emphasize that, we are the only academic medical center, and yet we must face the threats to us. All these were deemed key. Such threats include our current level of state support, which you know is at 4.9%, a decline from previous investments. Vulnerability of disproportionate share hospital payments, and those of you who I've been talking about DISH payments must be sick of it, but the legislature is meeting now, and our fates is often in their hands, but we elect them. And likely declines in graduate medical education that we need to face as a place of higher education. Potential threats to the notable turnaround of the financial situation of the hospital as compared to its performance in 2012, which is not that long ago. These vulnerabilities are even more acute today, need I remind you. In the year 2017, with the reduction of DISH payments a reality as of the fall of 2016, and a possible repeal of the full name of it is the PPACA, the Patient Protection and Affordable Care Act, translating to diminished federal support to our key clinical mission as a safety net hospital, providing emergency, essential acute, and chronic care to vulnerable populations such as children, the elderly, veterans, individuals with disabilities, our LGBTQ communities, underinsured and uninsured populations, as well as our recognized role as a tertiary and quaternary hospital system. As a reminder, and I don't know that you need reminding, but I thought I would do it, we are the only level 1 trauma center for 1.8 million individuals, the only children's hospital, the only burn center, one of 2 poison control centers statewide. We provide transplantation for potential fatal illnesses related to kidney failure, diabetes, and other cutting-edge interventions. The environmental scan was cognizant that our payer mix is 61% public, Medicare and Medicaid, 20% commercial, 11% managed care, and 8% other. We have benefited from Medicaid expansion throughout the PPACA, informally known as Obamacare, resulting in a greater number of insured individuals. But the analysis is complex given the reimbursement rates and continued need for bad debt and charity support in a system that has enrolled an additional 22 million individuals nationwide and eliminated pre-existing conditions to the inclusion for insurance coverage, reducing, therefore, the uninsured rate, but still without the needed compensation for gaps in our payment structure, which is not universal. But we are not only a hospital, so we could not compare ourselves to Krause or St. Joe's. We are an academic medical center, so the need to examine how to invest in our distinct and unique academic mission required that we focus on integration and internal collaboration, questions posed to our external reviewers. This approach to our charge as an academic medical center would require that we focus on the connectivity to our complex organization as reflected in this visual. I set out to obtain the external review and to move forward with the basis of understanding of our current state, the state of this complex organization. In short, the conclusions of the external review were as follows. Acknowledgement that our university has faced challenges over a period of time, and that 5 previous environmental scans have concurred with the current findings. That is, that overcoming a number of interconnected, organizational, structural, social, and cultural issues was urgently needed. But prior reviews had not led to substantive change in response to this critical assessment. So we should pose the question, how can we assure that this time around change would occur? While affirming that the current organizational structure would infer a more tightly integrated model of governance, we are not a comprehensive university, we are a health science university, and we have one purpose. Significant progress, however, would occur only if all stakeholders and constituents of SUNY Upstate became better aligned in more trusting, coordinated, and collaborative relationship. So as such, we identified a unique opportunity in this past year to execute through the creation of a dynamic leadership team of the highest quality to lead to the transformation of Upstate. that there needed to be fostering of alignment and better inclusion of the department chairs and institute and center directors. I think many of you are present today. That the integration of the faculty practice plan into an aligned and coordinated, clinically integrated delivery system was needed. That we could contemplate enhancing the role of college council and fostering creation, perhaps of a community advisory board to be much more linked to community purpose. That we could initiate a strategic planning process for clinical program development that includes component parts of our university, that is, the campus, the practice plans, and university hospital. Develop a new funds flow model, and develop a new and unified faculty physician compensation model, and develop a comprehensive research strategic plan that aligns with the university's size, resources, clinical initiatives, and the education and training of students at all levels of training. The external review recognized that the draft strategic plan that I proposed, and some of you may remember my many bubbles and circles, right, offered a number of high-level goals and objectives, and I concluded, though, needed more granularity, more specificity, and metrics. So in proceeding, a necessary first step was to create a new Office of Strategic Affairs and Regional Strategy. And the first action towards this, which you know, was the recruitment of our first university-wide senior vice president for Strategic Affairs and Regional Strategy, who began his tenure on July 1 of 2016. The recognition that we are in a high-tech and data-rich environment in the 21st century was obvious. But how to leverage those technologies to lead to clear, focused, data-informed strategies across the university enterprise was not so clear. While I had articulated a vision and preliminary strategy of key objectives during my selection in my initial months as president, what was needed was a more structured, disciplined, and participatory approach. This led my decision to also engage the Ballot Scorecard Institute for a systematic approach to planning. While the full rollout of the plan will be April 12th, as you see in the poster outside, let me review some of the essential steps that we have already taken in our process and that I have communicated to you throughout the year. The strategic planning process consisted of many group meetings to develop the foundation, the themes, the measurable objectives to our strategy map, and those of you who have participated in that process know what I'm talking about, but I thought I would summarize it very briefly for you. The related initiatives were outlined in vital steps of allocating resources. I know you're going to wait for the punchline, but you're going to have to stay with me because it's going to take a few words before I give you that punchline, okay? Allocating resources to those initiatives with a timeline for implementation and assessment. Remember my comments about strategy and eating lunch. This process was prioritized to debunk the notion that strategy plans are of no value. I discussed later in the talk the results of these plans tied to actual and future funds flow and discrete commitment of resources. So as we began to unite organizationally to define our goals and objectives, and most importantly, to determine how we were going to execute and grow our operations, we needed to focus on the content of our work, of your work. So let me now transition to the second theme in our vision statement, expertise. A moment ago, I noted that we are the only academic medical center in the region. So what defines an academic medical center? The literature is replete in discussions, and the baseline components of an AMC include clinical care, education, and research. The U.S. has approximately 130 to 140 academic medical centers with direct ties to medical schools. These centers have varied operating profiles, as outlined by Foresight Health in a recent publication entitled The Rise and Fall of Academic Medicine. Okay, stay tuned. By David Morlock and David Johnson, dated December 14th of 2016. In their treatise, the authors compare academic medical centers to, can you guess? The rise and fall of the Roman Empire. Okay, you're still with me, right? Okay, very good. Stating that, quote, Rome wasn't built in a day and didn't collapse overnight. They point to internal conflicts, administrative complexity, a wasteful consumption that made Rome vulnerable to external attacks and led to the overthrow of its last emperor in 476 CE. Students of history know that this is only a partial history, and that the plague played a major role in the decimation of half of the population and the demise of Rome from its original state. In their side-by-side comparison, the authors go on to identify the first academic medical center in the 1890s, developed by Johns Hopkins, modeled on the research-oriented German institution, where that business model, remember, it's a business model, combined clinical care with medical education and research. They point to what we are experiencing now, the struggle of academic medical centers to provide a more integrated, patient-centric, and cost-effective healthcare delivery system that must fund their academic and education missions. This is not new to you. You know it. Hence, the clinical enterprise is seen as the engine, but not the impetus for the system at large. While the threats to the academic medical center, due to its very nature and composition, how do we derive greater overlap, greater connectivity, thus affording more matrix levels of intersection to maximize intended results? Where is that sweet spot? The authors posit that if we need, what is needed for the survival of an academic medical center is, quote, new thinking and strategic repositioning. A few notable facts are relevant to this discussion. One, the 140 or so academic medical centers operate 60% of the nation's level 1 trauma centers. Remember what we are. Treating the most difficult patients, graduate 17,000 physicians and train more than 30,000 medical residents, and conduct the majority of NIH-funded research. These latter endeavors are supported by public and private funds, as is our operation here at Upstate, along with clinical care subsidies, for example, DISH, and philanthropy, our Upstate Foundation and Alumni Association. This combination of missions, if you've thought of it, biomedical research, education, and clinical care, as reflected in our mission statement, is unique in organizational enterprises. I don't know how many of you think of this. Not mirrored in other schools. For example, can you imagine a law school that then has law practices set up right next door within that and is part of its operation? Doesn't exist. Or an architectural school that then says, okay, build that building right next here alongside your educational mission. So we have a unique enterprise and therefore unique challenges that we have to put our heads together and not underestimate the challenge. So how can these potentially misaligned enterprises survive within the current market and political context? What is the solution? Where does our strategic planning lead us? Where must we invest our energy? Can we and others survive as an academic medical center or fall as did the Roman Empire? Or perhaps it is not a fall, but a transformation to a different system. There are several considerations as we ponder our own existence, our own state, and our expertise as an academic medical center. For example, where can care be provided that is community-based, cost-effective, team-based, family and patient-centered, and yet provide cutting-edge applied science, such as precision medicine? Can a regional strategy, as we embarked on, with community hospitals, for example, the acquisition of Community General, provide some solutions? Should we pursue other such investments? The question posed by a regional strategy. Second, given the increased life expectancy of many populations, data, demographics, what is the best quality of care for end of life, where so much of our resources are spent? What are the innovative models of care that need to be explored? Family-centered geriatric care would appear to be one important area. What is the quality of our care? Are our investments worth the outcomes we achieve? Most analyses have concluded that the American medical system underperforms. How about Upstate? Well, our university hospital has hovered between 1 and 2 stars out of 5 for our Vizient rating for the past 6 years including the past year. So there is clearly room for improvement in our quality metrics. But that improvement needs to go much further to implement a truly clinically integrated system that focuses on population health as well as precise, personalized care for the most difficult illnesses. How can we improve the quality of our care? How do we define quality? Is it family-centered? Is it related to the epidemiology of the diseases that we see in our surrounding communities? Do those things connect? For example, every morning I get, or throughout the day, Paul is here, he emails me gunshot injuries to youth and young adults in our own communities. Have we linked those problems to our task here? Do we make the hard choices with respect to high-cost, low-yield interventions? Are we willing to make those tough choices? Are we willing to invest in health promotion, prevention, life course, lifespan perspectives, everything I talked to you about when I came as president here, to address the social determinants of health through our investments in children, for example, funding of health care that is equitable, et cetera? You've seen some drafts of our strategic map and access to education, to novel research findings, and to clinical care has been at the root of that. For example, our policies with regard to Medicaid, Medicare, indigent care, and medical education to fuel the training needs to transform care. The recent efforts in DSRIP, which we are involved in, the Delivery System Reform Incentive Payment Program, which is designed to reinvest Medicaid program, to reinvest in the Medicaid program with the primary goal of reducing avoidable hospital use by 25% in 5 years, which is the national goal. ED visits and hospitalization is an example of such attempts at transformational efforts, but we have a long ways to go. We are engaged in that transformation, but we have a long ways to go. We have not involved community-based organizations to the extent that we should, and we have to work hard at it. There are many lessons to be drawn from other healthcare systems around the world that have made significant investments in public health interventions that reduce morbidity and mortality. Unless you think I'm just here pontificating, I will get to some dollars and cents. So continue to stay with me, okay? But if we develop the expertise, do we know how to develop the expertise to master these interventions? Can we be united as centers and institutes in these efforts? And I'll refer to that later in my talk. What is the role of research? NIH research funding has plateaued in recent years, and just yesterday, and I got this at the Faculty Council meeting as well, the university signed onto a letter to our senators and representatives on behalf of the Associated Medical Schools of New York to speak against the proposed severe cut of $12.6 billion, which represents 16.2% from the overall HHS budget, and would reduce funding to NIH by $5.8 billion, 18% loss for that agency. These proposed cuts come at a time when we have yet to maximize the translation of novel research to the bedside practice and community to enhance individual and population health. Also, what other types of research should complement this? You know, this basic science research, yes, but other things. For example, clinical research and health services research, implementation, patient-centered research, et cetera. There are other fields that require strategic partnerships with public health, specifically the Department of Health, community-based organizations that, as I mentioned, to address different perspectives and to look at actual effectiveness of the research interventions in real-life settings. Our expertise will help to chart these novel pathways, new scientific discoveries, and more effective healthcare systems that align academics and health. But this path will not be easy and will require of us a reframing of our vision, our processes, and tough choices in our allocation of resources. It will also require an intense focus on health policy, which I'm not sure we've done a lot of here, but I think increasingly we have to. So let me outline some of the achievements of the past year. The framework of these accomplishments is our strategic plan, and for if we do not know where we are headed, we won't know how to get there. So our roadmap, which you will be introduced to, is a roadmap to transformational health science university system will be launched next month. The themes, which I'm going to run through very quickly, is integration, that we function as one university, and that we're aligned in leadership, and that our culture of inclusion and transparency and trust is evident, that we employ innovative learning and discovery, so that we know that the choice for patients, employees, educators, and learners and researchers know their destination, that we have community impact, not just community engagement, but that we begin to make a difference and we measure those outcomes in a collaborative, and we are trusted partners in the service community and the 6 nations around us. That execution and growth at Upstate will be an excellent university growing through aligned, structured decision-making, and I've covered some of that. These themes have led to the development of 4 overall objectives. The next objectives, thank you. Increased reputation for excellence, improve health outcomes, reducing health disparities, and increasing access. And just a couple of words on that. We are a very diverse Upstate community and communities. We've not focused very much on health disparities for our underserved populations. The group that met together really went through all of this to identify our highest priorities at the university level. These are cross-cutting across the entire university. The next series of planning will then relate to your specific units. And what you will see is that all of these will need to be supported by the underlying organizational capacity, internal processes, and financial stewardship. A lot of this may be boring to you, but if we don't know where our money's coming from or going, if we're not good stewards of that, we will repeat the mistakes of the past. And if we do not know our internal processes, that we trust that we make sure that there's integrity, we will repeat mistakes of the past. These concepts have necessitated and will continue to need your full engagement, the clinical leadership, deans, chairs, center institute and directors, hospital and ambulatory administration. And the white paper that details the progress to date will be posted on the web this week, at the end of the week. The process has involved, as I mentioned, engagement of the BSI Institute, the involvement of more than 100 people who directly participated in the process, the shared voices of over 500 members of the Upstate family, the roadmap, and a detailed SWOT analysis. So continuing to our expertise, I want to briefly detail the state of this Upstate University report to you with some highlights of achievements of the past. These are fully cataloged in the presidential annual reports, and I'll be posting the executive summaries of all of the annual reports that were given to me that I requested this year, and those will be evident and transparent to you, okay? So I first embarked on the work needed to move ahead, and let me describe this. So I launched an international search for a leading scientist to serve as the Senior Vice President and Dean of the College of Medicine. I'm happy to say that our process has been robust, and that began March of 2016, for those of you who may have been wondering, with the engagement of the academic advisory group, Merritt Hawkins firm, the organization of Representative Search Committee chaired by Dr. Patty Kane, distinguished teaching professor and chair known to many of you in Department of Biochemistry and Molecular Biology, and Dr. Luis Mexico, professor and chair, Department of Neurology, professor of ophthalmology, bringing the strengths of vision of our basic science and clinical departments together. The selection of a 20-member search committee representing a broad cross-section of the College of Medicine and University that represented faculty, students, researchers, clinicians, all of the colleges, hospitals, and other leaders. A charge given to the committee by me, including a general orientation of the search committee to unbiased review of all candidates and commitment to diversity, equity, and inclusion. Transparency with our process that is fully detailed on the website, which I hope you have been visiting. An explicit charge of the following: to recommend to me only candidates who, without question, could serve to their satisfaction as dean. Our current state is the following. The Advisory Council of Merritt Hawkins reviewed all applicants, a total of 54. 37 CVs were forwarded to the search committee for review. The search committee participated in airport interviews of 15 candidates during 4 separate sessions. These interviews were carefully reviewed, and the committee forwarded 7 top candidates who were then interviewed for an extensive 2-day on-campus interview from November to March. 1 candidate withdrew prior to the visit. All interviewers throughout this process were asked to complete an evaluation of each candidate and results provided to me. And of course, I've read every single review. January through March, which is now where we are, 3 candidates returned for subsequent visits, which included an open forum, and those involved as interviewers and observers were welcome again to give their feedback, which were reviewed. In early April, I will announce a new dean of the College of Medicine and senior vice president of the university. We have had a successful process. During all these processes, respect, transparency, inclusion, shared governance, commitment to our vision, mission, and values were demonstrated. And I believe all enjoyed the open forum stream live throughout the university. Notably, all candidates were of exceptional caliber. I thank all of you who participated in the process, and I did tap many of you who spent a couple days interviewing folks, but thank you for that. That was important. I especially thank our 2 co-chairs and Chris Liberty here, who skillfully orchestrated the administrative aspects of this search. And I have to tell you, there wasn't a single applicant who came to see us who didn't say the following 2 things. One is they were truly impressed by the individuals here. And the second, they said, listen, regardless of what the outcome is, thank you for this process. And that was a goal, that no one should visit us and somehow through that process walk away, whether they're the chosen person or they've chosen us, walk away from that process with anything other than taking a deep breath and saying, this was a privilege to come to this university. And uniformly, that was the experience. So I do thank you for that. Other accomplishments are many, and I detailed just a sampling in brief, but would refer you again to the executive summaries of all those who report up to the president, and those reports have been placed, as I said, on the web. We initiated and promoted an all-funds budgeting process. That sounds easy, right? No. Developing funds flow changes with existing structures, and for the first time in 2016-2017, budgeted a planned investment in the academic mission of $5 million, which represented only 0.5% of university hospital revenue. I also began implementing a budget process that encompassed all sources of revenue across the practice plans, hospital, and campus. Again, seems intuitive, but we had not done that. This new process is evolving, so you're going to have to stick with us. This is a work in progress, but has necessitated combined meetings. I think my executive team is tired of meetings, but it's been important to understand what one side of the university does and what the other side does as well. The new process has many meetings, more discussions to assess alignment and strategic goals and objectives with determination of funding priorities, improved communication with the deans, UMass chair, hospital CEO, CFOs, senior vice president for strategic affairs, and me, and others as necessary to develop a more integrated and holistic view of budgeting and setting of priorities. At the root of this evolution is the development of a foundation of trust and transparency. And if you wonder why I'm keeping your attention here, and I hope you're not falling asleep, because this is long, but the past year has been long. So I'm having you involved with me to share in that journey, okay? So keep at it. We recruited a new academic leader, Dr. Amy Tucker, as medical director of ambulatory services and leading primary care specialist. And note that this hire is the result of collaboration between our practice plan and university hospital with dual reporting responsibility, demonstrating the application the past year of focus on integration and collaboration. But this was the first time that this was done. So that was important. And I thank those who thought of it and came together at the table. Our research has been fruitful with 11% increase in total research expenditure, 18% increase in indirect cost recovery. Thank you to the researchers. We established a new Office of Interprofessional Education and hired a new IPE director with sponsoring of strategic planning and visioning retreat. We are 4 colleges, And when I came, the College of Medicine was certainly at the table for the executive committee, but the other colleges were not represented. That changed. All of the colleges. We cannot achieve this mission without all of us together, and that means we are equals in this. We are in a pre-planning phase regarding the establishment of an Institute of Transformative Learning. So while a new curriculum was launched for the College of Medicine in the summer of 2016, and I want to recognize the efforts of those involved, there's a recognition that Upstate lags behind in educational innovation. Therefore, we must accelerate our progress towards this. The selection of a new dean of the College of Medicine, our IPE efforts, the new simulation center, and the Presidential Symposium for Transformative Education to be held spring of 2018, okay, will set us well on the path to transforming our educational curricula. This is critically important. We are a place of higher education. The innovations that I've seen occur nationally, we need to get on board and accelerate that progress. And we have the talent here. If you don't get the message, I am a perpetual optimist, okay? It doesn't mean that I don't have glasses on, yes, and take a look at where we are. But that doesn't stall our progress. We just need to keep going. The College of Graduate Studies continues on a solid ground. Currently 136 students, including 111 PhD students, 17 MD PhD students, and 8 MS students. The return on investment for our graduate studies is 11-to-1, and I want to thank the dean who reported on the ROI, because I'm going to talk money in a second. That is, for every dollar we put in, we get 11 back in grant support. We're going to have to calculate ROI. We're going to have to hold ourselves accountable. Whether it's our educational mission, our research mission, or our clinical mission, we're going to have to collect the dimes and nickels. Pretty remarkable and an industry standard. And our diversity profile, however, for these scientists in training does need greater attention. We don't have the diversity that we should have. And we need to address that as a leading organization. And if we don't make it a priority, it will never be a priority. Our College of Health Professions has seen a change in leadership with the resignation of Don Simpson, but we were fortunate to identify, and I appointed a strong internal candidate for the interim dean, Dr. Catherine Beisner, whose leadership has been stellar, including her leadership in the preparation of our second presidential symposium, March 30th and 31st, which is next week, on society and health. If you remember, we began with genes and precision medicine. Yes, a clear focus on science and what we do. But now we have to also look at the context of what we do, which are the social determinants of health, and begin to partner with others in addressing some key problems in our area. So I thank Catherine. Our College of Nursing accomplishments include the full accreditation of the DNP program and the graduation of the first DNP class. Congratulations. A new online BS degree program was launched, and need I say it, the College of Nursing moved to its new academic home on campus in the beautiful new academic building. We engaged the Whitkeffer search firm, who I met with this morning, which was chosen through an RFP process for the national search for the Dean of the College of Nursing, which I hope we will identify before the end of this academic year. I do thank Drs. Cleary and Schmidt for co-chairing the search committee on this, and for Dr. Cleary for serving as the interim dean for the College of Nursing. We opened the Cord Blood Center of the community campus and have high hopes for what it offers to patients and families and to research. Our efforts on diversity, equity, and inclusion are being integrated in the substance of the strategic plan and continues its important work in maintaining organizational compliance with federal, state, local laws as they relate to affirmative action, Title IX, equal employment opportunity, and prohibition of discrimination. I thought it was important for you to know some of the work that happens behind the scene to make sure that we are absolutely committed to equity. Our Upstate Foundation efforts are extensive and demonstrable, and the foundation was ranked 4th of 64 state-operated and statutory colleges, trailing behind only Stony Brook, University of Buffalo, and Cornell. And we obtained a platinum distinction for GuideStar, the leading source of information on nonprofit organizations. We should celebrate that. I also thank the Alumni Association for its effort focused on student scholarships. As promised, we completed the College of Medicine salary equity study. Did you think I'd forget? Okay. And those results have been presented to the UEC, adjustment made in response to those results, and I have authorized a salary equity study of all the colleges. This effort will not be deemed a one-time effort, however, okay? It needs to be a systematic and periodic review to assess our adherence to the principles of equity. We have completed a refurbishing of the halls of Weiss-Cotton with particular attention to recognizing the diverse and incredible leadership of the past. I don't know if you remember when I was coming on board that there were a lot of demonstrations nationally with respect to the lack of representation of a diverse faculty and diverse representation. Well, we attempted to move forward in trying to address that. Our librarian and archivist will continue to assist us in faithfully representing the diversity and talents of our leaders. We welcome a new interim hospital CEO, Stephen Scott, who will assist in the development of more robust administrative processes. We are poised to develop a more fully clinically integrated network, and in that vein, engage Manatt Health, a division of Manatt, Phelps, and Phillips LLP for consulting and advisory services in support of Upstate's Medical University's clinical strategic plan. And this will include the following: development of a regional upstate hospital network. We do not have such a network now. Development of regional physician network, hospital strategic financial forecasting. I don't have to tell you that we are in changing times and very challenging times. If we do not have the data in hand to understand how the data inform us to what we do next, we will fail in our mission as an academic medical center. The development of more integrated faculty practice model, development of integrated health sciences university strategy and operating model. This engagement is timely to fully leverage some of the successes which I think you're familiar with. For example, the receipt of $146 million in grant funding for Upstate's University Hospital, including $70 million capital restructuring financing program fund to create and to support the goals of DSRIP, and $75 million New York State budget to build the Upstate Health and Wellness Center. Other accomplishments, you know, the new pediatric emergency department, improvement in our HCAP scores, a shout out to our nursing staff, okay, in large measure due to their excellence. And while Nancy Page is at a conference in California, couldn't join us, she is headed for magnet status, and that is something that we need to aim for, okay? Implementation of EPIC, hiring of a new medical director, as I said. So much of what we have achieved this year was possible through the incredible efforts of University Executive Committee, the Extended Committee, senior leadership throughout our enterprise, and all of you. And I do want to recognize them. I was going to have you stand, but I want to make sure I finish my talk today. So thank you from me for all your work. Now, needless to say, among them, those members is Dr. Dewan, who began as the interim dean of the College of Medicine mid-October 2016, and I want to publicly acknowledge his contributions. And I will be infinitely grateful to him for agreeing to step into this role as we launch a national search for a permanent dean. Thank you, Dr. Dewan. And this will make Dr. Dewan smile, so the following. So I want to announce that Dr. Dewan has taken the lead to develop the plan and the mechanism to increase our College of Medicine class size from 160 to 170. Most important to note, and this is important, this is his message to you, is that the dean of that college has worked with faculty to ensure that this increase will not affect the educational experience and planning for additional clinical placements already underway. The recruitment of the additional 10 is focused on out-of-state students. The revenue generated from that tuition will be used for scholarships. 2 weeks ago, anticipating these changes, Associate Dean of Admissions and Financial Aid, Jennifer Welsh, offered 5 full tuition and housing scholarships to students from backgrounds traditionally underrepresented in medicine. This speaks directly to our strategic plan and mission in many ways. And this is only the beginning. We will have a strategic plan to grow the College of Medicine and our other colleges through strategic enrollment and to meet the challenges that face us today. And if we're not strategic and really focused on it, we will miss, but I don't intend to miss. Other accomplishments: appointment of a new Director of Community Relations, Linda Veit. We welcome Sergio Garcia as our new Chief of Staff of the Office of President and Vice President for Operations of the university. In that role, he has joined the University Executive Committee and EUEC. And to start, I certainly laid it on him, okay? I asked him to do the following two searches: Director of Government Relations. He has gone back and forth between Washington and Albany many times, and he's only started, what, March 1st? Okay. But he had to hit the ground running. A national search for a Chief Diversity Officer, as we thank Maxine Thompson for incredible service and wish her well in her planned retirement. We will have time to celebrate you. Okay? Mr. Garcia will also be responsible for a number of things, but this is one I asked him to do as an initial thing. He will work with legal counsel to develop a university-wide policy on sexual harassment. We'll talk more about that later. We don't have a university-wide policy, and while I think our practice may reflect some good practices, we need a university-wide policy. I also want to acknowledge the important work of the College Council and ask the members of the Council. I think that many couldn't come because we changed the dates. The Council really has been invaluable to me, and as part of our strategic plan, we will outline to you how Tom Taylor and others have been working with me to develop a real community advisory purpose. So I have many to thank: our university police, who always take good care of me, even when I get stranded. Our departments, administrative, clinical, research, faculty, staff, and I can't name you all, but I do want to thank you all. So in the last two sections, yes, it's a long speech. Next year will be shorter. Okay. Compassion. All right, so let's move on to the next work in our vision: compassion. Where would we be? What would we stand for if compassion were not part of our vision? There are many ways that a university can actively demonstrate compassion. Some brief examples are the following: a commitment to excellence as demonstrated by the quality and sensitivity of the care being given to patients and families; efficient management of scarce resources; active support of our students' access to higher education, intellectual development, critical thinking, freedom of speech, and expression unimpeded by biases; a resolute path in support of translation of novel discoveries to alleviate illness and disability in a diverse population, respecting culture, language, autonomy, and tradition; our inclusiveness as suggested by our language, our tone, and respect for each other. And as I reflected on how I could demonstrate to you my commitment and this institution's absolute commitment to compassion, I thought, who best to represent this than our students? Those from our health professions who at the start of their professional lives have embarked in a lifelong pursuit to serve others. So with the help of Dean White for Student Affairs, I asked our students to help us take a look at our compassion. Their voices came through the efforts of Jim McKeever and Eric Zabrinski. Thank you to both and the students who are here on the clips.
Good afternoon. My name is Anushri Gulwadi. I work in Dr. Chris Turner's lab in the Department of Cell and Developmental Biology. My research involves finding mechanisms that cancer cells utilize to move from one part of the body to another. Science excites me, and that's why I wake up every single day of my life. It's not a routine. I wake up because I want to make a difference. Also, I work in cancer research, and everybody knows somebody who's affected with cancer, and so did I. That's the reason I wake up every day to go to lab, to do my part for biology, to do my part for science and cancer treatments. In science, not every day is a good day. There are days when our experiments fail. There can be months when our experiments fail, and usually we're let down. But all of us, my colleagues and my mentor, we help each other to keep motivated and just be hopeful that maybe the next time we do it and we do it in a different way, that time it may work out. Compassion is an asset because it brings meaning to what you do every single day. It gives substance to every experiment that you do in the lab.
Hi, my name is Duke Nguyen. I'm a second-year medical student, College of Medicine, class of 2019. Lived an itinerant life. I've traveled everywhere. The last place I was from was San Diego before I landed here in Syracuse. I think compassion is vital to what we do. I think we all have a little bit of kindness in us, but I think what we really want to look for is a setting and a practice to exercise that kindness. And I think at Upstate, I found the kind of setting and practice that will allow me to exercise compassion in the future. I found exemplary models in the faculty, and I found surprising models in my friends. The faculties are very compassionate, not only in how they treat us, but also in how they treat patients and how they allow you to really interact with the patients and with them. I think more surprising than that, I found great models in my friends. So a group of classmates and I are involved in this project called MEDS, Medical Education for Diverse Students. We bring in Syracuse high school students who are challenged in many ways, and we teach them. We use Upstate resources to teach them physiology, medicine, and more than that, we want to introduce them to healthcare so that we get them excited and keep them in the community. We want to show them that they too have the power to act compassionately. So I think that is one of the projects of which I am most proud. As I've said, I have had an itinerant life, and I've lived in DC and New York City, and I have to say that what I found at Upstate has been really inspirational. I have found a way to gain this agency, to really exercise kindness. I think that's what is most uplifting about Upstate.
So thank you for listening to this. I thought I'd give you one last example of what kindness we choose to express to each other and that we care to give to others. It's emphasized by how we listen to each other. And I thought I reached out to my pediatric colleagues in giving you this last example. This is of a 2-year-old child whose parents wanted him to die in a peaceful surrounding of home. It was cared for by our pediatric team. And they remarked as follows: it was, quote, a humbling experience to be in a patient's home during such a personal part of their lives. The child lived a few hours, and his family was extremely thankful for this opportunity. The child was extubated and died peacefully. So it always makes me pause when I reflect on my journey in the last 30 years plus of what our purpose is. And so the students helped me to do that. And the final, it is, yes, it's getting to the end. It is fitting to end my talk with the word hope. The hope and conviction that our academic medical center and Health Science University will continue to evolve, utilize new technologies, and reinvent itself rather than fall, as is suggested in the analogy of the Roman Empire. I want to describe 3 final scenarios that provide fuel to this hope. One is what we represent as a place of education, a university that is protected by certain principles. In the past year, our students and faculty have been very concerned regarding our new immigration policies. And I, the chancellor, the chairman of the Board of Trustees of SUNY, echoed our deep commitment to the university as a sensitive location, such as schools, preschools, primary schools, secondary school, post-secondary schools, up to and including colleges and universities and other institutions of learning, such as vocational and trade school, where enforcement actions, for example, related to immigration, arrests, interviews, searches do not occur unless extraordinary circumstances exist. We encourage dialogue, exchange of disparate views, and intellectual curiosity. We embrace diversity as a quality component to our mission of education, service, and education. In support of our founding principles as a public institution, a system of higher education, a SUNY Board of Trustees resolution reaffirmed just in this past month our support of undocumented students. As a university, my message in support of all of our students is unambiguous and hopeful. The second is that no matter what the healthcare landscape, our commitment to health and our focus of improvement of lives will sustain us and allow us to reinvent Rome rather than have it fall. This is what you and I are all here about. I want to share with you, and I'm going to go through quickly, but this will be available to you so you can review the numbers a bit more. I want to share with you some of this reinvention that we have begun with explicit allocation of resources to those endeavors. And those who participated with me can attest to the fact that this has been a laborious and tough process. When you ask people to share resources and share money, then you know it's down to brass tactics. In any case, I am nonviolent. All right, so. All right. I know it's getting long. The hour is getting late. Okay. So let's take a look. Again, some of the best tools to fight our cynicism and skepticism are results, right? So take a look at the current and proposed interventions. I'm going to go through it quickly because we're all getting tired. But they underline system changes, implementation of current strategic priorities, and development of a conceptual framework plan for the next 5 years. This is what you're going to have a chance over the next few weeks to take a look at. So the first slide you see here, the Cancer Center big sign was outside when I came here, right? I did not invent that sign, it was there. And yet we had not made some commitments. And if you put a sign up but you don't make commitments, it's not worth anything, right? So we did have some commitments. I did put dollars and cents here to begin to share with you that it required a number of things. The current state, which is 2016-17, budget approved. That means that we are hiring folks. The monies have been allocated. Yes, behind closed doors, we fought it out. And then we allocated for the next 2 years the dollars that you see here. Clinical faculty recruitment, research faculty recruitment, research infrastructure, co-management agreement, medical oncology integration, pilot grant funding, outreach coordinator, and we have a plan that is not, that we will certainly look at the metrics and take a look at how we're doing, but that plan is a long-term plan. Return on investment, you remember that I mentioned that term. So what is that? Well, I think traditionally it looks at dollars regained, new revenue, grants, indirects, et cetera. I suggest to you that there are two measures, and I use the example from our graduate study result of 11-to-1 for our graduate studies, is that we must look at both quantitative and qualitative measures, but then try to define them in terms there. There you see how they relate to the strategic plan. Increased reputation, we're going to have to define some metrics and define that, okay? I'm going to move on, but here, Cancer Center, I did appoint an interim director for the Cancer Center, Jeff Bogard, and I thank him for his contributions, and we will head towards an NCI designation, okay? We will do that. Office of Strategic Affairs, I mentioned, and you see the dollars allocated to that in the process that we've engaged in. Ramesh Sachdeva regrets he wasn't able to be here because he thought this talk would have been given last week, and he is at Stanford in developing structured decision-making analyses plans so that we look at data and use data to inform our processes. Next slide, please. This one, comprehensive ambulatory care. I heard from many of you, where is our presence in primary care? Where is our commitment? Well, I redefine primary care. I am a primary care doc, by the way. Okay? I redefine it as comprehensive care. All right? That means that we really need to allocate those dollars. You see the dollars attached here. This was to set aside dollars to create comprehensive strategic priorities around our care. And you'll see the ROI that is listed there, and we will come back to you with more details. An Institute for Global Environmental and Community Impact, and believe me, till the wee hours, which was just this week, we then agreed that we cannot plan for just a few months or a year even we need to plan long-term, and our investment in global environmental and community impact is firm, and you see the return on investment there. We propose a Heart Institute, all right, with the commitment that you see at the current state, which is the current recruitment of Chief of Cardiac Surgery and Chief of Cardiology initiated, and a preliminary model of the Heart Institute, which will have to engage both close and more distant partners in this. Stay tuned for more details there. An integrated upstate healthcare regional strategy. I mentioned the engagement of Manat Health. We don't have currently a strategy for whether it makes sense to repeat the experience for community campus. While it has been good, we need to set the model on how we do that. Next slide. The systems changes, I mentioned global budgeting. We need to look at a funds flow, internal alignment. There are lots of external relationships that we need to rekindle because we don't live in a vacuum. Guidelines for centers and institutes, we will present that to you, and a number of other things that you see here that we've committed to that are in the current state of planning, and we will give you more details on that. And the final slide here. So there are others in the works, okay? The Office of Strategic Affairs, team leaders of the initiatives to develop business plans here we need, and also determine allocation of resources. That doesn't mean that these activities are not going on. They are, but they're not well orchestrated and well organized and synthesized. So let's go on to the next slide, okay? So having the legacy of the mission of science, yes, I promise it's the last thing now, okay? To serve people and populations, I believe that given this, we will survive. We will not fall as the Roman Empire has fallen, and you will hear that term, that academic medicine is dead. I don't believe it. We will reveal the metrics that will be tied to our strategic priorities and our resource allocation on April 12th. These metrics will allow the tracking, as I mentioned, monitoring and evaluation. For example, to progress to a 5-star hospital in 5 years and to be a top university. Lastly, the third example of hope is what we stand for. I believe that to function as one university, a university dedicated to creating a healthier world for all, alignment of our various university sectors is absolutely necessary. This observation has been validated by many who have come to our university and validated by our own experience. But alignment is not possible without respect. So in closing, I want to share with you the following actions that I believe constitute respect. One is to recognize and acknowledge the opinion of others, to engage with openness and, might I say, with an open heart. To sit and talk, dialogue is key, and I was reminded of the campus conversations when I started in being recruited here, that we must focus on purpose and to attend that rather to ourselves, that we must explore common solutions, connect on points of agreement, and together take charge and create a positive outcome. I hope you will join me in this journey. We have a vision as expressed through the 6 presidential symposia connected to the future and our roadmap, which is our strategic plan, that will be fueled with the best data to lead to meaningful information and informed and wise decisions. There is a hopeful path forward if we choose it. Please join me in this challenge. This is the presidential symposium for next week. Thank you.